Hi, I'm Brady Ryan with WBBA, here with Rebecca Norlander, CEO and co-founder of Health123. Rebecca, thanks for joining us.
Thanks, Brady.
So we're here at Life Science Innovation Northwest, and Rebecca, I understand that Health123 gave a talk earlier today. Could you give anybody who wasn't there a little bit of information about who Health123 is and what you guys are doing?
I sure can, of course. So Health123 is doctor's orders on demand. Essentially, we take follow-on care instructions that you would get. You go to the doctor, he or she gives you a piece of paper, or maybe gives you a couple things to do. You leave, you lose the paper, you can't remember what you committed to, so you don't actually take care of yourself.
Sure.
For a lot of us, if we're well, doesn't matter that much, but if you have a chronic condition or you're post-surgery or doing something where the steps actually matter, we help them digitize the content, put it in the cloud, so it's accessible by the patient from a mobile or a web device, accessible by the provider, and we allow them to set up steps, have secure communication back and forth, and ultimately super personalize it for the patient so that they're more likely to actually stay on track. There's a huge amount of spend out there today. Something like $200 billion of spend is due to people not adhering to their plan of care or to their medication. So we want to take a bite out of that and ultimately help people feel better.
Okay, great. So what's your background?
So I am actually a technologist by trade. I have been, I was at Microsoft for almost 20 years. And I worked on the Office platform, the Windows platform, and the online advertising platform. But my interest in healthcare came when I was a child. My mother had rheumatic heart disease, and it necessitated several open heart surgeries and valve replacements. With her first mechanical valve, her overall systemic health improved to the point where she didn't need, not only did it save her life, make her heart work, but she didn't need eyeglasses anymore, and she was delighted. And as a 12-year-old, I was completely tickled that you could take a piece of technology and put it in someone's body, and it would actually make them that much better. So I had intended to study biomedical engineering, but I fell in love with computer science. I knew computer science would be the underpinnings. So when I left Microsoft, I came back to my roots and I decided to get back into technology meets healthcare to make the world a better place.
That's great. So we like to think that there's a ton of problems out there that can be solved with technologies like Health123. So it's interesting to hear from a technologist that made that transition. Kind of seems like you always had that in mind. But do you have an idea of how we can get more devs and technologists to see these problems as the next problems that they should solve?
So I think that there's a two-part answer to that. First, let me be really clear. What we do with technology is scale a human relationship between you and your provider. Digital tools in and of themselves can help people, but really it's about the human connection and scaling that digitally to be more successful. In terms of getting more people to be involved in healthcare from a technology perspective, I think that we'll see as more startups become successful and as technology plays a larger and larger role in our own health, our personal health, the health of our parents, etc., more folks would be incented to go into that overall space.
Sure, great. So for the company, where are you guys right now as far as customers, funding, and kind of what's next 6 months, 12 months?
Yep, so we've been around for a little over 3 years. We did a lot of friends and family and research work around making sure we had the right user experience and business model. We've got 4 or 5 local customers, Vera Whole Health, Aravale, Group Health, and Seattle Children's Hospital, where we have different paid pilots. And so what's next for us is we're closing out a seed round right now, a seed 2 round, and prepping for our Series A. Our goals are for Series A to get to $75,000 to $85,000 monthly recurring revenue. Make sure we add additional customers and make sure that we've got some great evidence-based outcomes from the pilots that we've done so far. So we're looking forward to, at WBBA, meeting additional potential customers, friendly angels, and other people that would be great connections in the overall industry.
That's fantastic. So how can people get involved, and how can people contact you, and why should they get involved with Health123?
Well, with Health123 specifically, we're always looking for great developers. We'll be looking for some sales and business development folks, and even some folks on the marketing side. So you can send your resume to jobs or hot jobs at health123.com. I am Rebecca at health123.com, so you can always send mail to myself or to my co-founder, Rachel, at health123.com. Come to the website. There are buttons that you can click to send us mail. There's all kinds of ways to find us. And I also come to a lot of the WBBA events, and so, you know, Brady, you and other people know who I am, so you can always point me out to people. Of course. Well, thank you very much for joining us. Again, I'm Brady Ryan with Rebecca Norlander with WBBA-TV. Thanks a lot. Thanks, Brady. It was great to be here.